Good afternoon and welcome to this City of Toronto COVID-19 media briefing for Friday, March the 26th, 2021. Joining us today is Toronto Mayor John Tory, and here for questions is Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. And I am very pleased to be joined by Dr. de Villa and by Chief Pegg. We've been operating very much as a team. My message today on behalf of our team Toronto, is very simple. Please get vaccinated. The city and its healthcare partners have so far administered 436,443 doses of vaccine. So that's 436,443 shots in arms so far. But we have a long way to go. And we are in a marathon race between the virus and vaccines. It is one that the vaccines must win, and key to that is your willingness to sign up now to get vaccinated. As a city, we have put more shots in arms than any other city in Ontario, and we aren't going to stop until everyone that wants a vaccine gets one. We are continuing to ramp up our clinics' capacity as more vaccine is made available by the Government of Canada. We are vaccinating thousands of people a day in the city, but we now have the capacity for more, and we need you to use that capacity. For example, at our original 3 clinics, we were previously able to vaccinate 1,350 people per day. Starting Monday, we will be able to vaccinate 6,300 people per day at our city-operated clinics. As we announced earlier today, we have almost 30,000 appointments available over the coming week for people to get vaccinated. We need you to sign up to use those appointments, and it will be good for you and for your family and for your friends. And the information is here in front of me as to how you can sign up. I'll repeat it in just a moment, but it is, from everything we've heard, whether you do it on your own or whether you get some help, it is simple to do by telephone or online, and we need people to sign up. We need people to get vaccinated. The sooner we are all vaccinated, the sooner this pandemic will be over. And that's why we're pushing so hard today to encourage people who are eligible to get vaccinated right now. Don't wait. Now is the time to do it, with appointments available, with vaccine supply available, with the clinics up and running. Now is the time to register and to get vaccinated. And that is why I am announcing today that we have worked with the province of Ontario to lower the eligible age limit at our mass immunization clinics here in the City of Toronto to 70 years of age and above. Just as many hospitals across the city have already done, we will start allowing people from 70 years of age and over to make appointments starting at 8 o'clock tomorrow to get vaccinated at any of the city-run clinics. So starting at 8 o'clock on Saturday, anybody 70 years of age or over can make an appointment by going to the website indicated here or using the phone number indicated in front of me to make an appointment to register to get vaccinated. This is a significant move, and we are confident it will lead to more people signing up, just as we have seen when we've lowered the age previously. This means that starting this weekend, people born in 1951 or earlier can now get vaccinated at the city clinics, which as of Monday will be 6 in number. And our work to vaccinate people 75 plus and 80 plus will also continue. And we're sparing absolutely no effort whatsoever to make sure that we get those people to get registered and to get vaccinated. We announced earlier this week a number of measures in that regard. So I encourage all Toronto residents who are eligible to get registered and get vaccinated as soon as possible. And I strongly encourage everyone who knows someone who is eligible to be vaccinated. Starting Saturday, it will be 70 plus. Even today, it is 75 plus. You can encourage those people to register. Help them to register if they need any help, but encourage them to register and get vaccinated. Help them to book an appointment to get this done. We have vaccine doses. We have clinics that are open and operating, with 2 more opening on Monday. They are easy and convenient to use. So please go to toronto.ca/COVID-19 and click on the big blue button at the top of the page that says Book a Vaccine. Or call the provincial call centre at 1-888-999-6488. That's 1-888-999-6488. You can also see it here. We are at a crucial time in our city's fight against this virus. So many people have sacrificed so much over the past year. We see the cases of variants ramping up, and we see the troubling numbers. But we're also at a day when we have vaccine supply. Supply we've been waiting for, but we have the supply. We have the clinics ramping up and up and up. And we have a united effort across the entire city with Toronto Public Health, all of our hospital partners, our community healthcare partners, Ontario Health, and pharmacies, all working together to get people vaccinated. We need you to respond now. This is the largest vaccination effort in the history of our city. It's absolutely unprecedented. We have already vaccinated more than 436, or administered 436,000 doses. The vaccine is our best weapon against COVID-19 and against the third wave, so-called third wave. But we need people to get vaccinated. So again, if you are eligible, please sign up. That is your most useful contribution that you can make on the front lines, not in months or in weeks, but now. This is a battle that we must win, and it is a battle that we will win. But we need your help signing up and persuading others and helping others to sign up, and we need that help now. Thank you in advance for your anticipated support, and we're able to answer your questions as you wish.
Thank you, Mayor Tory. First question will go to Beatrice Vyman from CP24. Just a reminder to please unmute yourself. Beatrice?
Good afternoon, Mayor or Dr. de Villa. I'm happy to have either of you answer this. What do you think is going on? Clearly, like you said, we've got the vaccine supply, we've got the clinics up and running. People now know how to register online or by phone. So what's preventing people essentially from getting their butts into the seats of these clinics to get vaccinated?
I think it will help us a lot when we have a bigger promotional campaign going on, which I understand is going to start on the part of the province next week. We've undertaken a big expansion to our clinics, both in terms of the number of clinics and in terms of their capacity. And so in that sense, people aren't necessarily aware of the increase in capacity, which was following an increase in the supply that was committed to us. But I think a lot of this just has to do with psychology that many of us are familiar with, that what we see each time that we come and talk with people about this is a spike up for a few days, and then it tails off again. And I think that people are waiting for a variety of different reasons. Some people told researchers in the beginning they would wait just to see what happened and that sort of thing. And I think what we have to do now is just make available to people the capacity, which we have done, make available that information to them so they know there is the capacity there for next week, and continue to adapt and make the efforts that we're making specifically, for example, with the over 80 populations, which we continue to do. We are looking at all kinds of things that are presently underway to reach out through various lists like the Wheel-Trans customers, the Toronto Community Housing residents who are seniors and where we know their age range, to make sure that effort continues as well. But our job is to keep these clinics going and to keep every appointment booked and make sure we get as many vaccinations as possible. Now, if there may be a more adept medical explanation or psychological explanation that the doctor can offer, and I'll offer her the chance to do so.
Thanks, Mr. Mayor. And I would say that the Mayor has addressed many of the points. What I can add further, though, is that I think we can tell stories about how successful vaccination is, and that may be part of a broader promotional campaign. When I look across the data, for the entire province, in fact, there hasn't been a single death in long-term care since the 19th of March, if I've got my dates right. And that tells us, that's not luck. That's actually the effect of vaccination, right, as vaccination has rolled out across the province. So there's a lot of good news stories to talk about here with vaccination. The vaccines are safe, they're effective, and I think if people wish to find out more about vaccines, there are lots of reliable sources of information. I would look at our website, I would look at Toronto Public Health's hotline, pharmacy, doctors, lots of people that you can consult with if you want to find out more information about the benefit of vaccine. And I would just encourage people to take advantage of this amazing intervention that's here that will effectively protect you and protect everybody around you.
Dr. de Villa, my follow-up's for you. We just had Dr. Michael Warner from Michael Garron Hospital, ICU physician, on CP24 this afternoon, and he essentially says that the color-coded framework does not work in hot zones like here in Toronto, and that we can't be talking about opening when things, are seemingly getting worse. Also, he adds that the vaccines were not distributed properly, and I know that that's under the provincial purview, but he suggests they need to be redistributed from regions that are not in as much need and given to hot zones in Toronto and Peel. What do you say to that approach, Doctor? Should vaccines have gone to hot zones like Toronto first?
Well, I think when we look at the available science, certainly making sure that vaccine is getting to those who are most at risk in respect of serious outcomes associated with COVID-19 infection, that's priority number one. And in fact, that's what we've seen. We've seen long-term care homes and retirement homes, all those who are resident in those settings and those who are staff and essential caregivers actually getting those vaccines first. And as I've just mentioned, we're seeing the benefit of that, and I think that's incredible. We're also aiming at those older populations, hence starting off with that 80-plus population and then going down in the age categories over time. I would also say that there is science that supports, focusing vaccine efforts in those places where there is COVID-19 activity or elevated COVID-19 activity. The science certainly supports that. The science also, of course, supports what each of us can do, right? We know the measures for self-protection work. So I would encourage people to please continue to practice those measures for self-protection, maintain that distance, use that well-fitting mask in those instances where you can't or you need to be outside, you can't keep your distance effectively. And of course, when it's your turn to get vaccine, please go get that vaccine. It's the combination of these public health measures and vaccine that will see us through and get us to the other side of this pandemic.
Thank you, Doctor. We'll go next to Beth McDonnell from CTV News. Beth?
Hi, good afternoon, Doctor and Mayor. With the rise of variants and their risk, Mayor, you talked about this being a marathon race. How do we catch up? How do we get ahead of these variants to make sure that more people are protected?
So why don't I start off, and then I'll give the Mayor a chance to add anything further. And I think what you're hearing the Mayor describe as the many actions that we're undertaking as a city are exactly the kinds of things that are needed in order to ensure that vaccines are being distributed effectively and in a timely fashion so that we can actually offer that effective protection to as many people as possible as quickly as possible. So certainly we know that having a broad range of clinic opportunities, mass immunization clinics, clinics in hospitals in many different locations, and having several different access points, whether we're talking about pharmacy or primary care or mass immunization clinics run by the city. These are the, having a wide variety of options available is certainly part and parcel of getting as many vaccines out there as quickly as possible. As well, there are a number of other supports that have been put into place to help facilitate access, whether we're talking about transportation endeavors or we're talking about having our colleagues at Toronto Public Library call out to their senior clients and people that they know to ensure that they're aware of how they can get access to vaccine and how to properly go about booking those appointments. I think it's this range of different services and supports that actually moves us closer and closer towards the goal that you've just described. Mr. Mayor?
I just want to follow up on what Dr. de Villa was just saying there, because I think if you add up all the things we're doing, and there's more to come, we are doing everything we can to stimulate the demand and to make sure that when the demand is there, we can meet it. And the very point of my coming forward today and of our having advocated to the province and I thank them very much for the fact that they have agreed to let Toronto move down to 70, is so that we can make sure the demand is there to use every one of these appointments, every one of them without fail, to get somebody vaccinated, because every vaccination is a good one, no matter who receives it. We want to make sure we continue to work at the senior population in particular, but we are offering transportation programs we announced earlier in the week. We are going through lists of people, whether it's Wheel-Trans or whether it's the library or whether it's our own lists. We are going to commence advertising this weekend, and the province will soon follow next week. We are likely to make telephone broadcasts to people to encourage them to sign up, so that we're going to be leaving absolutely no stone unturned to make sure that every spot that Chief Pegg and his team have very capably made sure are available to us with dramatically increased capacity in a short time, following on the availability availability of supply, that those will all be used and more. And I think we've indicated, I certainly did to the Premier yesterday in my conversations with him about all of this, that we have the capacity to do more on a daily basis as soon as we can be assured that supply is available, because we've always planned on the fact that this had to reach, ultimately, our wish would be to have it reach 3 million people, which is the number of people we're responsible for.
Follow up, Beth?
Thank you. When it comes to city-run clinics, can we expand the hours? Would this make it more accessible, allow more people to sign up?
We, from the outset, have planned and have plans in place for the expansion of city-operated clinics, and that includes the operating hours and the parameters and timeframes for those clinics. At this point in time, there are appointments available every day in each clinic, absent of having to expand those hours. So as the Mayor said, and as Dr. de Villa had said, I'll just add my voice, there are appointments available now. And I would suggest, and this is what I believe, the most important thing is if you are eligible for a vaccine right now, please go online or call the number and book your appointment and come and receive your vaccine. When we get to the point where we have all 9 of our clinics, in addition to our partner-operated clinics, operating at full capacity, and I long for the day. I look forward. I'm hoping that next week we can stand here and say that we are fully booked, there is no availability, and we're ready to expand. When that happens, we're absolutely ready and have plans in place to bring back to the Immunization Task Force Command Team opportunities for expansion. But at this point, we are still bringing additional clinics online, 2 more on Monday. That makes 5 city-operated plus the partner clinic at Thorncliffe Park. With very, very short order, we'll be in a position of 9 city-operated clinics plus the partner clinics. So once we're there, if the demand continues to drive, additional hours, I would be very, very pleased to take it to Mayor Tory and our command team for consideration for expansion.
Thank you, Chief. We'll go next to Mark Carcassel from Global News. Mark? Stop to unmute yourself, Mark. Mark, if you're on a phone, star 66 will help you unmute. There you go.
Hi there. Can you guys hear me now?
We can. Go ahead, Mark.
Can you hear me now?
Yes, sir.
Okay. Sorry about that. My question mainly, I guess, is for Dr. de Villa, but anyone who wants to weigh in, feel free. There's no doubt that personal care services have had it really tough during this. Many of them haven't been able to work legitimately since December. There seems to be some speculation, probably some hope too, that at the provincial level, restrictions will be eased sometime soon to the point where they can at least cut hair, do nails, whatever the case may be, outside. And I'm wondering, Doctor, if you have any thoughts on that possibility.
Well, that is still news to me, so I'll be interested to hearing about whether the speculation becomes reality. But I will say this. We do know that in general, activities that are conducted outside are lower risk in terms of COVID-19 transmission, but that doesn't mean that there's zero risk. So I think that, we are looking at our current circumstances, as we always do, and recognizing that as the weather improves, there are opportunities for us to better utilize outdoor space, and therefore try to create opportunities for people to get some of the activities and services that they're used to having and that we miss in safer environments. So I think it's certainly worth, looking at when we see some details, but I would just remind people that while outdoor activities are certainly lower risk relative to activities and interactions that happen within indoor settings, it doesn't mean that there's no risk. So continued vigilance with respect to those measures for self-protection, maintaining distance to the greatest extent possible, wearing a well-fitting mask for those occasions where you do need to be out and about and perhaps interacting or have the potential to interact with others. These continue to be the mainstays of our toolkit to prevent transmission of COVID-19, and as well, of course, getting vaccine when your turn becomes available.
you have a follow-up, Mark?
Yeah, just one. So, Doctor, I guess you haven't heard that as any sort of speculation from the provincial level, but is it something that you've discussed maybe at the municipal level? Is that something that's come up in your discussions?
You know, at the municipal level, and I know the mayor will echo this, we're constantly talking about what opportunities there are on the go forward. And you've probably heard me say this at previous press conferences, that, you know, as we start to, implement vaccine and get vaccine further deployed and start to imagine life after the pandemic, or as we get closer and closer to that end, it is, I think, really important that we all engage in these discussions around how do you effect as safe a possible reopening for all services and all activities, so that we can start to restore, you know, the various activities and services and businesses and the, you know, all the different aspects of life in the city. So this is the kind of conversation that we have, you know, on a daily basis. Of course, right now there's a lot of emphasis on the vaccination efforts and that which is happening in our mass immunization clinics. But there is, you know, always an eye to the future, making sure that we're actively planning together how best to ensure that safer reopening when the time comes.
Thank you. Oh, sorry.
Please.
Just further to what Dr. de Villa said, I gather there may be some announcements the province is in the midst of making at this moment that indicates some degree of flexibility on some of these things. But again, our watchword has been on discussions we do indeed have every single day has been caution with regard to this, because of the numbers that we see and because of the threat posed by the variances. But as well, it is equally important that we emphasize the message we're emphasizing today, which is for people to get vaccinated. Because in the end, yes, we have to continue to, even after getting vaccinated, you have to be vigilant about wearing a mask and not being too close to others for a period of time while the vaccination takes effect, and because we're still working the number up of those who are getting vaccinated. But we have that as an equally important priority to what could continue to be and should continue to be a cautious reopening, cautious so that we can keep the health situation in control, and cautious so that we can avoid ever having another lockdown, hopefully. Again, that has been an objective all the way through, but we discuss it every single day from every aspect you could imagine.
Thank you, Mayor. We'll go next to Mark McAllister from City News. Mark?
Thank you very much. Mayor, while you're at the podium, if you would, this has a sense of urgency, your message today. It's not just a, hey, we've got more appointments available, everybody sign up, please. It's something's wrong. And why the sense of urgency? Is there a hesitancy out there within the population of Toronto or within this specific demographic?
It's interesting. I saw research from the beginning that said half the people were kind of, very much accepting of the fact they would go right away to have their vaccine. Very few questions asked. And there were another large group of people who said they would want to wait and see and observe various things, whatever it might be. And I think that plus the fact that we were limited in our capacity at the beginning by the lack of supply. And I think now we have to address those two things and say, okay, time has passed. We've had great success stories like the one outlined by Dr. de Villa with respect to long-term care. And so I think the evidence is there that this is a safe, very helpful, relatively simple process to go through. The call center and the provincial scheduling system have worked very well. The clinics have worked very well, and I think it's more a matter to make people aware of the fact that we have substantially ramped up our capacity because we now have new supply, and that the ramping up in that capacity has to be accompanied by people responding to that and coming forward and saying it's time. And it's time for themselves, it's time for their neighbors and their family, and it's time for the overall war effort we have going on here, because this is a war on this virus and a war on these variants, and it's a war we're going to win. But it's one that, we have to keep at, and we have to keep at both sides of it, the public health guidance and the safe and cautious reopening of the city, but also a very aggressive effort to make sure people know that there are these spots available and that they should step forward, hopefully, and get themselves vaccinated now, as opposed to waiting for some supposedly better time. There won't be a better time than now. There is no better time than now.
Thank you. I'll further that a little bit. Obviously, earlier in the week, Chief Pegg, you had mentioned There were issues. You dealt with those issues at the clinics in terms of lineups and other inefficiencies. Perhaps it was a case of people seeing that and maybe not wanting to sign up right away because they've seen problems and they're worried.
Mark, I don't really know whether that's a fact. We were very transparent on Monday and on Tuesday and moving forward, and I honestly don't think I could be any more clear than I was and that our team was collectively that day. We experienced some logistical challenge on Monday. That's just a matter of fact. And immediately upon becoming aware of those issues, we went to work and resolved them. And that was evidenced by Tuesday, Wednesday, Thursday, and today with literally seamless operation. It is an efficient, effective, safe, and enjoyable flow in all of our clinics today. We've even gone so far and in what Mayor Tory describes as wartime speed, been able to put things in place now that provide additional comfort and protection against inclement weather. So our clinics are operating well. I've been in them personally. I can tell you this, if I had the opportunity, if I became eligible to get a vaccine today, I would immediately go and book my appointment for that vaccine. I would walk into one of our clinics with nothing less than pure confidence. I would move through that process and receive the vaccine and come out the other side with the selfie stand and tell the world that I did. And that's the way I feel about it. I have dedicated my entire career to doing all that I can do to affect a positive impact on public safety. And that is frankly why I took this role on. It is why I continue to serve in it, and it's why I stand in front of you today. What we're talking about, making the conscious decision to get vaccine, is an element, it is an aspect of doing something positive for yourself, for your safety, for the safety of your family, and for public safety at large. And that's frankly the way I feel about it. That is the energy and the vigor and the viewpoint that we have put into the design and operation of every one of our clinics. And that is exactly how we will continue to operate as we expand capacity until we get every one of our residents vaccinated and until this horrific pandemic is behind us.
Thank you, Chief. We'll go next to Momin Qureshi from 680 News. Mo, go ahead.
Yes, good afternoon. Just to put it bluntly, is there more of an issue with vaccine hesitancy than was anticipated?
So, Momin, I would say I don't believe that that's the case. I think what we have is, an excellent program here, as you've just heard from the chief. We have vaccines, which are a miracle of modern science. I continue to be amazed by how quickly we were able to bring effective vaccines as a scientific community to market, and so that people are actually able to use these products, and we're seeing remarkable effects. I marvel today, and I continue to marvel at the impact, the positive impact that has been provided in our long-term care homes, in our retirement homes. And you can look across the world. It is remarkable what has happened in so many other countries as vaccine uptake increases and as people are experiencing the effectiveness of this vaccine. Vaccine hesitancy is always an issue, but we actually have a number of different methods by which to interact with our public, understand what the issues are, and ensure that we have an effective mechanism by which to address questions and concerns. I think people should absolutely feel confident. I too, like the chief, have every confidence in the vaccines that are available, and would strongly encourage people that this is safe, it's effective, and it's the best thing you can do to protect yourselves and those around you. So I strongly encourage people to please go take advantage of the vaccine that's been made available, and of course to discuss with reliable sources any questions, or to just seek out information. I think an informed public is a very strong public, and it's actually one of the strengths of our city.
Okay, thank you. I understand Momin does not have a follow-up, so we'll go next to Jennifer Pagliaro from the Toronto Star. Jen?
Hey everyone. My first question is for Dr. de Villa, and perhaps Chief Pegg can also weigh in. Dr. de Villa, I asked your team just before this conference, and they were quite accommodating in sending me the numbers. And they say that of the 75 to 79-year-olds in the city, approximately 21% have already been vaccinated. And given the fact that the province only opened the majority of booking appointments to that age band on Monday, it actually seems to me like that's a pretty positive number. That was as of 9 a.m. Thursday. So when I look at that, it actually seems like that age group is responding quite well to the availability. And so I'm just wondering if you can comment on those numbers. It seems like this rollout actually may be just moving faster than we anticipated.
So Jen, I don't know that I can speak to the specifics of those numbers. I imagine some of them might be long-term care or retirement home residents. And because we are fortunate to live in a province where we can actually seek out vaccine from a variety of different sources, we know that other jurisdictions may have moved towards this age bracket, and as well we know our hospital partners have moved to a 70-plus age bracket as well in recent days. The mayor did mention that. So I do think that there are a number of different ways in which people may have accessed vaccine and why you're seeing those numbers. But I think fundamentally what I'm really pleased to see is that, one, there's uptake, and two, I would encourage more and more people as their turn comes up to please take advantage of that turn. Take advantage of the remarkable development of these vaccines. They're safe, they're effective, and they are our way through this pandemic and ultimately back to the way of life that we all have missed for the past several months now. I don't know, Chief, anything further to add?
Jen, all I can add to what Dr. de Villa said is when the province reduced the age and made open the eligibility for the 75-plus age group, on that Monday, we saw thousands and thousands of people log on to the system and successfully book their appointments. That's exactly what I want to see. That number was very high. It continued. Of course, we still see significant numbers of people booking their appointment. What I'm excited about is with the announcement that Mayor Tory made, and certainly with my thanks to the province for now reducing that eligibility to 70, I expect we will see the same thing. I would expect that we'll see another very considerable number of people booking their appointments, and that's exactly what we want to see. My goal, the goal that all of us share, is that we can fill every available vaccine appointment in every one of our city-operated and partner clinics on a go-forward basis until we have this behind us. So I look forward to watching what those registration numbers will be tomorrow.
And then can I just ask maybe, Chief Pegg, this is for you as well, so I'll just ask you to maybe stay there. Yeah, thanks. In terms of trying to get a push here for 75 plus to sign up, and then with the opening to 70 plus tomorrow, I'm just wondering if you could speak to the vaccine availability, those shipments we see on the news coming in, and their shelf life, and whether there's any concern that you're actually not getting enough appointments as quickly as you need to make those vaccines viable.
Sure. So the clinic capacity that you're seeing that we forecast, and that includes the opening of additional clinics on Monday, all of that activity from a logistics standpoint is coordinated directly and in live time with vaccine availability. It's actually happening multiple times every day. So all of that is being proactively managed. Of course, there would be no value in us opening clinic capacity and not having vaccine to match. So we've matched that. It is being proactively managed. Of course, things like expiry dates and all of those things are being fully factored and considered. And most importantly, I think maybe equally, if not most importantly, we have very, very proactive strategies in place in every clinic where doses are not wasted. So there is an administration plan, there is an active vaccine management plan that is happening by the clinicians, at the hands of the clinicians in every clinic, making sure that A, we are delivering as absolute many doses as we can based on appointments, and that no doses are going to waste. And I can say that that has been highly successful. We are in direct collaboration with our healthcare partners and, of course, with the vaccine distribution task force that the province operates, making sure that our allocations are where we need them, when we need them, and that any unused doses that may happen as a result of missed appointments or whatever the case may be, that those doses are being reallocated and put into arms at the hands of our partners. It's actually a a well-orchestrated machine. It's a big machine to operate. We have some fantastic people that are managing that very, very well, and I just continue to be impressed with how well that has gone, and we look forward to continuing to expand that.
Thank you, Chief. We'll go next to Nick Boisvert from CBC News. Nick?
Hi, thanks everyone. We've been hearing from some community health groups, other groups that work with seniors, about the fact that there's some elderly people, maybe 80 plus, who are perhaps avoiding some of the mass immunization clinics for a lack of comfort, maybe with going to some of them, and that they're waiting perhaps to get this through their family doctor or something else that they're a little more familiar with. Do you have a message to someone in that age range who's feeling that way?
I will start, and perhaps my colleagues may wish to echo or add their own comments. What I can offer is this. I have had the privilege and the pleasure of being in our clinics when they're operating and literally having the opportunity to speak with residents over the age of 80 as they're coming into the clinic, as they move through, and as they go out. It has been having those conversations with some of our senior residents as they come out and have just been vaccinated. It is one of the most heartwarming experiences of my life. There is a sense of relief. There is a sense of hope and optimism. And I will say that based on that alone, that is all I would ever need to see. And I will probably never do justice to trying to express to you what I feel watching that happen. But anyone that is watching this conference that are hearing these words, please come and experience the same thing. The clinics are set up well. It is a seamless process. We have trained healthcare providers and first responders who are there from the time you arrive. We will help you move through the process. If you require assistance mobility-wise, we're prepared to do that. It is seamless. It is organized. It will be quick for you. And I can't stress enough the smiles and the optimism on the face of these folks as they're coming out of the clinics. I stand outside, I watch smiles, I watch cheers, and that's what we're looking forward to, and I can't wait until we get to see that across our whole city. Perhaps Mayor Tory or Dr. de Villa?
I'd just like to add this. On this very day, we're not just operating the mass immunization clinics, we're operating several of those, and our partner clinics, there are 33 clinics in operation across the city, so that there are vaccinations being delivered in almost every setting, including mobile clinics. And so I think that while I recognize the fact that in some of these larger ones, people may not feel that sense of comfort, or maybe even geography comes into play, although we've tried to spread them across the city in a fair manner. But I think that there are a number of options open to people. The Premier and I had a discussion yesterday, which we've also discussed, about getting primary care givers more involved, including doctors. But the one thing people should not conclude is that we have the ability or the resources or the capacity to, we're going into Toronto community housing buildings, and in some cases like that, doing things where people are. But we will have a program specifically for those who find themselves for medical reasons, housebound. But people will have to take from a wide array of options. In most cases, one of those options, we're putting transportation assistance in place to make that happen. We have all kinds of community organizers that are going to be going out effective in a very few days to help people get to the places where it's going to be easiest for them. So we're making it as easy as we can with as many options as we possibly can, recognizing that not everybody would find it either convenient or to their liking to go to one of those clinics. But even today, there are dozens of those clinics of all different kinds in operation across the city.
You have a follow-up, Nick?
Okay, yeah, sorry, I thought Dr. de Villa was coming up there. I understand, I know the city had anticipated vaccine hesitancy, especially among communities of color, as this campaign got rolling. Now that we have hundreds of thousands of vaccines administered, do you have any evidence that that's actually playing out as these are being given out?
I will start in terms of the success of the seminars that we had, and Dr. de Villa will want to comment on the experience in the field, but before and after the seminars we had across the city, we asked people questions, and the attitude before was quite different than the attitude after, in that once you took the time, as you would do with any citizen, to go through the ins and outs of this and some of the scientific evidence and so on, and dispel some myths that might exist, and so on, people were much more positively inclined. And so that was a very positive lesson in terms of the impact that those seminars had on the hundreds of people who attended them, and maybe Dr. de Villa would comment on what's happened in the field since then.
So thank you, and I think the Mayor has covered some of the key points, but let me just add this, that when it comes to any medical intervention, I think people understandably, I should say, and rightfully have questions. And I think it's reasonable to ask those questions and to get, to go to good, reliable sources of information to understand what is the nature of the intervention that we're speaking of here and what is the benefit that one might anticipate from this. And I think that, ultimately the best evidence is what we're seeing in practice. And it's not just here, it's all over the world. What we're seeing is that this vaccine has been given all over the world. These vaccines, I should say, have been given all over the world to people of, varying ages and with varying medical states at the outset. And we're seeing that it's safe and it's effective. So questions always welcome. That's part of medical practice. Very happy to answer questions and engage in good discussion, and really to look at the data that exists out there that tells us we have a safe and effective vaccine that protects oneself from COVID-19 and ultimately will protect the entire community.
Thank you, Dr. de Villa. Final question is to Denise Pagliaro from the Canadian Press. Denise?
Hi, thank you so much for taking my question. Seems like most of my colleagues would appreciate this. Would you mind commenting on the province allowing salons, gyms, barber shops, tattoo parlors to open up in Toronto as of April 12th?
So Denise, thank you for the question. I don't know of the specifics yet. As you can imagine, we're here. I haven't heard anything about what changes might have been made at the province. But a couple of things, and you've heard us comment on this already. We're at a delicate point in this pandemic, right? We're at a very delicate stage in the course of this pandemic. We are seeing some of our indicators moving in the wrong direction, and we're seeing increased hospitalization and stress in our healthcare system. By the same token, we have the promise of vaccine, and we're getting more and more supply. We have incredible systems in place. You've heard the chief speak about our mass immunization clinics that are being run by the city. There are also a series of various vaccine clinics that are being run by our healthcare partners all over the city. And we've seen what benefit vaccine can provide. So it's a question of how do we establish a good balance between making sure that we're doing what we can to control COVID-19 transmission until such time as vaccine can be used by a greater and greater proportion of our population. So when it comes to reopening, it should be done with extreme caution at this point in time so that we don't lose the progress that we've made thus far, and so that we allow vaccine to have the greatest possible effect. We know vaccines are effective. They will be more effective quicker if we reduce the amount of disease transmission that we have in our city and throughout the province. So very delicate balance that needs to be struck. Constantly need to be monitoring our current situation on the ground, and that includes making sure that people are taking advantage of vaccine as soon as their turn comes up.
Mayor Tory?
Thank you, Dr. de Villa. And
One moment, Denise. Mayor Tory is just going to answer that as well.
Dr. de Villa didn't have the advantage of a scrawled piece of paper that I had that indicated what the province might have announced during that time. But if the information that we've been given is correct, I would simply say this. The outdoor fitness activities that will be more broadly permitted as of the 29th are things that we, in fact, had suggested might be appropriate in our discussions with the province last week. And with respect to kind of mid-April time for personal services, I think that evidences a degree of caution, which Dr. de Villa just referred to, which continues to be appropriate in light of everything that is happening, as much as that may be disappointing to some, including me. So, but I think caution continues to be the watchword, and I think that continues to be what's applied in this case, as much as I know it causes difficulty for some.
Thank you so much. And either Mayor Tory or Dr. de Villa, is the upcoming reopening of personal care services, is that something you recommended, or do you agree with this?
We have been, as Dr. de Villa has indicated, as I've indicated, we've been in constant discussion on all of these matters with the province and amongst ourselves as to what is going to be best to allow for changes that happen on an evolutionary basis, but happen in a safe manner, in a cautious manner, given the fact that there are very disconcerting numbers that are out there. And so, the province makes these decisions. They made a decision today that, as we understand it, has application down the road, and I'm sure there will be continuing discussions even about that as we go forward, just because this situation changes, as we've seen day by day, and it is something where we can't declare ourselves out of the woods by any means at all. So the key message for today, please get vaccinated. And please spend the time you might have spent doing something else getting vaccinated. There are appointments available. There is a phone number that's easily used if you don't want to do it online. You can also go online to toronto.ca/COVID-19 and get vaccinated. Appointments are available. There's no time like the present to get vaccinated, and that will provide you with protection, as well as providing members of your family and others you associate with protection. So please get vaccinated. Thank you.
Indeed. Thank you very much, Mr. Mayor. That concludes today's briefing. Please stay well, and please get vaccinated. Have a nice weekend.